Hey everybody, Dr. Diane here. In this video, we're going to talk about natural treatments for Lyme disease. And I want to preface this with saying this is coming from my experience of treating and training doctors all around the world in Lyme disease, in mold illness, and chronic infections. And there's been a lot of evidence that I've gathered through my own practice, also through doctors that I've trained around the world and how to work with these conditions and in clients that they report that they have worked with. So as far as Lyme disease and natural treatment, so my personal feeling is natural treatments are far superior in chronic Lyme over pharmaceutical treatments. And this is because there's so much damage to the microbiome and to the immune system when we use these pharmaceutical treatments. So our immune system, which is not just in our white blood cells, our immune system is hugely located in our digestive tract, in our good bacteria of the body, which are not just in the digestive tract, which are in other areas such as our genitals, our urinary tract, our sinuses, our skin, on and on and on. And these microbes that make up our body, the healthy microbes, also do so much for our immune system. So this is pretty essential. So from the immune system component of things, we want to make sure that we're not doing things to harm the microbiome, and a lot of pharmaceuticals do. And this is why many people, when they're in chronic Lyme states and they've had Lyme for a very long time, and they're given things like triple antibiotic therapy, which makes sense to do in many ways, but it also destroys the microbiome. And this is why natural treatments I see tend to lead to such less rates of recurrence in people, because the immune system's high, because we haven't destroyed the cells and the cells function at a cellular level. So that's one of the huge benefits of using natural treatments. Another thing I do with natural treatments is pulsation therapy. So I do things like 5 days on the antimicrobials, the herbal antimicrobials, such as cryptolepis, such as cat's claw, goten, such as andrographis, and Japanese knotweed. There's so many great herbs out there, but the pulsation therapy is very, very important. So 5 days on, 2 days off. And what that's allowing the natural treatments to do, it's allowing for the spirochetes, the Borrelia, the Lyme bacteria to not move deeper into the system. Because oftentimes, because these types of microorganisms, they're corkscrew shaped, they have these tails, they can move very easily. So they can burrow in deeper. So we want to make sure that when we're giving the antimicrobials, we take these breaks, 5 days on, 2 days off. And on those breaks, what's happening is these bugs that are maybe burrowing deeper come back to the surface to eat the hyaluronic acid, to eat its food source, and then we hit them again. So really with natural treatments, it's about the combo of things. It's about how we use them. I often combine them in ways with using things like hyaluronic acid or molybdenum, which are huge food, or not molybdenum, manganese, which are huge food sources. The hyaluronic acid and the manganese are huge food sources for Lyme. So when we give Lyme these types of products, Lyme comes out of hiding to eat, and that's when we blast it with these antimicrobials. So it's about the combination. It's also about the pulsation. But natural therapies, like I said, my feeling is it's really important with Lyme to have all tools in the toolbox and not to rule out any treatment. There are definitely times for antibiotic use. I am, by no means, poo-pooing antibiotics. I think there's a great purpose for them. But I do see that the natural treatments have less rates of recurrence and work very, very, very well for most people most of the time. So it's a better first line standard of care, because we're not going to damage the microbiome in the same sort of way. So if you need any help for your treatment, please do see information about my clinic as well as my DIY programs in the show notes. There's also information for you in the show notes about how to get direct to consumer labs. If you're missing lab work and you just want to order something and you can't get your doctor to order it, there's information about how to get that testing done in the show notes. Please do subscribe if this has been helpful, and I'll see you in the next video.